So we're going to do a real simple technique. We may start by just coming in like this and loosening the fascia, twisting it. Notice how I'm internally and externally rotating as I'm leaning my whole body weight in here. So if I find a restriction, if his fascia doesn't want to go to internal rotation, that's where I hold it. I hook the fascia with internal rotation, wait for a deep hook, and then traverse down. Could come all the way down the neck if I need to. External rotation is easier on Kyle, so I'm going to continue with internal rotation. Hook the fascia. And now, just tuck your chin and come back out. Rotate your head. So I'm just holding it now that I've got a good fascial hook, and let it try to separate those things. They glue together and they lose individuality of motion. As you get older, you sacrifice complexity of motion for stability. Complexity of motion for stability. The body sacrifices complexity of motion for stability. It fuses itself up. The joint capsules and the ligaments get tighter as we age. It's a good thing. The body's doing that for a reason, because it feels like it's unstable. So I'm going to come back here and do upper traps, levator scapula. Come in here. And lateral and medial on people who have a little bit of a forward head posture, which most of the people will. If they are flat back, flat butted, and military posture, which sometimes you see, not often, you want to go the other way. You want to pull that tissue out, allowing it to have more curve. But we're trying to take the curve out. We're trying to pull those erectors, particularly longissimus and iliocostalis, back toward the midline. Feeling for restrictions. Sometimes I'll come in on some big, hefty, big guys and just, examine, kind of bounce around in there, feeling for stuff right there. When I did that fast, I could compare tissue to tissue. That's where Kyle, the only place that he's got some tightness. Can you feel that? Yeah. Okay. Just, yeah. Right there. Okay. So you don't have to pin back here if you don't want to. I just do it as a habit. Now I'm going to stretch the pecs. Let's get you on this end where they can see it better. Line your left side. And if you can stretch the pecs, do it. If you're not, you can get in the armpit and you can do the other stuff that we're going to do. But I always start by doing this because it not only gets pecs, but it gets the whole front line. You want this to all come back too. Remember, lats and everything are internally rotating, so you want to get it all back like this if possible. So I'm going to come in, traction, just to adjust my own body weight. That's the only reason I'm doing this, is so I can get my body in a proper position, so that when I come in with my elbow and I come in up onto the scapula, I've got him now. Now pull your elbow towards your nose. 2, 3, 4, 5, and relax. When you relax, I take up the slack. I'm not bulldozing the barrier. I'm just going to his comfort level. Again, 2, 3, 4, 5, and relax. And one more time. And relax. Pec minor. Pull your elbow towards your knees. I'm coming up on the superior border of scapula. 2, 3, 4, 5, and relax. And again, 2, 3, 4, 5, and relax. Grab the top of the therapy table. Lats come in. 30. How many pounds of pressure? 30, and then what? Add additional 20 to spring. He's got some pretty good movement in there. Some people you'll see are real pointy on the sides. Ida Rolf used to really make us work on that. You try to open, you can't take fish hooks and just pull the chest wall open, unfortunately, so you have to figure out a way to try to expand that chest anterior, posteriorly. And you do that by coming right on the sides of the rib, right at the apex of the point, and then you spring. And then you work. Pull up on the therapy table. 2, 3, 4, 5, and relax. Pull up. 2, 3, 4, 5, and relax. Then I can come in like this, which is what I usually do in my practice. I come in like that, okay, pull up, 2, 3, 4, 5, and relax. Now I'm getting a little bit of the, right at the border of serratus anterior and lateral border of lat. So you can do that. You can come in and get the lumbar border of the latissimus dorsi because it, it has its attachment down at the long dorsal sacroiliac ligament, even though it's innervated by the cervical ganglia. It's innervated by the neck, but it's actually a lower quadrant muscle, and it also controls arm movement. Weird muscle.